Hi there and welcome. My name is Dr. Marlena Jabara, and I'm the proud founder of RadPodSquad. The RadPodSquad Fellowship offers an immersive learning experience tailored specifically to podiatric imaging. RadPodSquad combines comprehensive curricula, cutting-edge techniques, and on-demand access to training that will provide you with the new knowledge and skills that you need to boost your confidence in imaging and truly make a difference in treating your patients. Check us out today, radpodsquad.com. So when we're looking at an MRI, what will go in the report? And I've created a checklist. So there'll be osseous pathology. In our reports, we'll be talking about coalitions and articulations, whether it be the tibio-talar, talonavicular, subtalar, or calcaneocuboid. We'll be looking at all those structures, plus assessing the anterior superior calcaneal process. For the midfoot, we're going to move on to take a look on an MRI of the ankle, the navicular-cuneiform and the intercuneiform. Looking at the midfoot, we'll want to see our tarsal metatarsal articulations and normal Lisfranc ligament. We'll be looking for fractures, osteochondral defects, and bone tumors by assessing that signal intensity of the bone marrow, looking for stress phenomenon. We'll be looking to see a presence of an osteochondral lesion, whether or not there are heel spurs, whether there's any marrow changes in the calcaneus. Those are things you can expect in our report. The tendons, we are going to come in on the medial flexor tendons, each one individually, all of the posterior tibial, flexor dig, flexor hallucis, whether or not there's tears, tendinosis, are they subluxed? What about the flexor retinaculum? Is that intact? You can count on these reports to have lateral flexor tendon pathologies outlined. We'll always want to take a note about the longus and brevis, whether or not there's a tear or if it's subluxed. We want to assess the superior perineal retinaculum on every case, whether or not there's a normal perineal trochlea, another important part. For the extensor tendons, these often resist pathology, but we'll be looking to see the tibialis anterior, looking to see its size in relationship to the posterior tibial, looking at our extensor tendons, our normal tarsal tunnel, assessing that deep peroneal nerve entrapment, whether or not that's present. We'll move into the sinus tarsi, assessing the subtalar ligaments, whether or not there's obliteration of the fat space. Moving on to the ligaments, we'll be assessing the syndesmosis, anterior, posterior, interosseous ligament. We'll be looking at our lateral collateral ligament complex, the ATFL, its relationship to the calcaneofibular ligament, and also the PTFL. We'll assess the deltoid complex, looking at the deep fibers first, moving on to the superficial fibers of the tibionavicular, tibiocalcaneal, or tibiospring. Moving those down to the spring ligament will be our job to assess whether the supromedial band, medial and inferior plantar bands are intact, or are they thickened, or is there a perforation? We'll look at the bifurcate ligament. That's that calcaneocuboid important ligament called Chopard ligament, and it also gives restriction towards the calcaneonavicular articulations. We'll look at the long and short plantar ligaments that support the plantar arch. Before we move on to assess even the Achilles, we'll assess the tenoosseous insertion. We'll take a look at whether there's a Haglund deformity and assess the presence of synovitis in Kager's fat triangle and paratendonitis. For the plantar fascia, we're looking for inflammation, masses, tears. Is there fibromatosis? We'll look at the muscles. Is there denervation atrophy? Do you have Jogger's ankle or Baxter's nerve compression? Is there some evidence of neural change? We'll look at our tunnels, both the posterior and anterior tunnels, assessing whether the posterior tibial nerve or the deep peroneal nerve, respectively, are compressed. Again, the sinus tarsi will be looking for obliteration of the fat space. And lastly, we'll always be looking for masses, soft tissue masses, cysts, ganglia, and are there any joint effusions? And that is a complete ankle MRI report. To create that report, we're going to assess multisequential, multiplanar MRI anatomy. And we can invoke checklists and patterns that can help us to assess the pathology. Are you ready to take your podiatric imaging skills to new heights? Check us out at radpodsquad.com. Explore our online learning community, and don't forget to like and subscribe to our YouTube channel for more enriching content.